The Food and Drug Administration, the Drug Enforcement Administration, and the Centers for Medicare and Medicaid Services are three paradigms of combined legislative, executive, and judicial powers that have devolved into cesspools of abuse and corruption. While studies of other agencies would no doubt yield evidence of similar corruption, these three agencies are illustrative. The FDA, DEA, and CMS have fulfilled the dire prediction of the founders that the union of the three governing powers in single hands would beget tyranny, as those in charge of the agencies use the instrumentalities of government to pursue their own self-interests. Each of these agencies is ruled by one all-powerful leader, an essential dictatorship. The FDA has one head and its commissioner. The commissioner of FDA can promulgate any rule, can overrule any judgment of agency medical reviewers, can order the prosecution of any regulatee, and can approve for marketing any drug, regardless of the scientific evidence that may exist against the drug's safety or efficacy. The Congress of the United States has vested in one person the enormous power to regulate everything we consume and use for our sustenance and health. All food, drugs, cosmetics, biologics, medical devices, and dietary supplements. There is little real check on the exercise of the FDA Commissioner's discretion, not from the courts, not from the Congress, and not from the President. The union of legislative and executive powers within FDA has yielded corruption, as the founders predicted, in the form of industry favoritism. Likewise, the DEA has one all-powerful head and its administrator. The DEA administrator can promulgate any rule or decision she desires, regardless of its economic impact. In her sphere of influence, she is all-powerful. There is little real check on the exercise of the DEA administrator's discretion, not from the courts, not from the Congress, and not from the President. Here, too, corruption exists in the form of industry favoritism. The administrator of the Centers for Medicare and Medicaid Services through Medicare contract carriers, insurance companies under contract to administer the payment of Medicare reimbursements to physicians, exercises vast control over the nature, quality, and quantity of medical care provided to almost every American aged 65 and older. Through that system, physicians accused of improperly billing Medicare are presumed guilty until proven innocent, are forced on pain of exorbitant interest penalties, withholding of tax refunds, and blacklisting on a national database, to pay the amounts in dispute long before a final and binding order, and are made to seek vindication in a 5-layered appellate review system virtually guaranteed to exhaust their resources in legal fees before they are ever permitted to seek vindication in a court of law. In all three agencies, there are favored regulatees who have essentially come to affect or control political and legal outcomes. At the FDA, that favored regulatee is the pharmaceutical industry, and more particularly, specific actors within that industry. At the DEA, that favored regulatee is again the pharmaceutical industry, which now enjoys above-market rates of return due to DEA enforcement to remove from the market independent suppliers of ephedrine and pseudoephedrine containing cough and cold remedies. At CMS, that favored regulatee is the insurance industry, which, in turn, is a proxy for the pharmaceutical industry. We can perceive abuses whenever agency actions sacrifice fundamental rights to life, liberty, and property to yield outcomes favorable to a preferred regulatee. At FDA, the agency's commissioner has repeatedly approved drugs that the agency's own medical reviewers have deemed too unsafe to enter the market, thus favoring the pharmaceutical company proponent of the drug over the American public. The results have been catastrophic, leading to tens of thousands of deaths and injuries. Likewise, FDA maintains a pervasive censorship over therapeutic claims for foods and dietary supplements to ensure that the drug industry enjoys a federally enforced monopoly on the right to communicate treatment information. At DEA, the agency's administrator has driven out of existence some 50 independent suppliers of cough and cold remedies, resulting in the loss of thousands of jobs, actions that financially benefit drug company suppliers to the traditional pharmacies. At CMS, the agency has permitted its contract carriers